if you keep doing stretching and don't do strengthening, or if you just start with the strengthening and don't do the stretching, it won't help much. These two tests will tell you if your shoulder pain is because of the impingement syndrome or it's coming from the rotator cuff injury. Assalamu alaikum. After watching today's video, you will be able to differentiate between an impingement syndrome and the rotator cuff injury. Once you identify that the cause of your injury or cause of your pain, then you can focus more on the strengthening and stretching of your muscles. The rehabilitation of the shoulder consists of strengthening, stretching, and gaining the range of motion of your shoulder joint. So let's focus on the stretching first. Let me talk about the first test. In the first test, what you're going to do is you're going to put your arm straight up in front of your chest, your arm straight, your thumb facing up first, and then move your arm a little bit at about 30 degrees from your chest, and then turn the thumb downwards. And then at this moment, if you are able to do that, take the other hand at your elbow and push it downwards. Once you apply this pressure, and if you feel a sharp pain at the tip of your shoulder, a little bit in front of the shoulder tip, that is an indication that you're having impingement of one of the shoulder tendons. The other test which you can do, which can also differentiate between a rotator cuff injury and the impingement syndrome, is that you put your arm the same way in front of your chest, shoulder right at the level of the elbow, or elbow at the level of the shoulder, and your hand right at the level of the elbow. Take the other hand with your left hand right behind your right elbow, and your left elbow resting on your palm, the back of the palm. In this position, you push it downwards and then inwards. So you're pushing your arm downwards and inwards. Doing this movement, if that causes a sharp pain at the tip of your shoulder, that's another indication that you're having impingement syndrome. It's not a rotator cuff injury. Now, rotator cuff injury and impingement syndrome can be converted into each other. One can start and it can shift into the other one, or the other one starts and shifts to the first one. So today we're going to focus on some of the stretching exercises for some of the soft tissues of your shoulder muscles, and later we will talk about the strengthening exercises and some range of motion exercises. So one of the stretching exercises for your shoulder muscles is that before we do these exercises, just make sure that your injury itself is healed. Let's focus on the stretching of these muscles in front of your shoulder first. So first stretching is, let's say this is the edge of the door. This is the door, and then you stand close to this edge of the door, the opening of the door actually, and then you put your hands, your palm of your hand, just slide it down all the way down, and then you stand at about like a foot from the edge of the door, and then you stretch your arm like this. When you do like that, you will feel the stretch going from your arm into the upper part of your chest. So you're going to stretch it like that, and you hold it for 5 seconds. Once you do that, then you come to the middle part of the muscle. So you bring your arm to the level of your shoulder, and then the same way you're going to hold on to this door edge, and then you're going to stretch your shoulder and your chest towards the opposite side. This time you're going to feel the stretch right at the middle of your chest going into your shoulder area. So you're going to stretch like that. So again, 5-second hold. I'm going to tell you in a moment that how many times you're supposed to do it, but 5-second hold like that. And the third stretch is that you take your arm above your head, not too high, because that's another exercise, but take it on the side, and then you stretch your arm again. You turn your head the opposite way, stretch your shoulder. You will feel the stretch towards the lower part of the chest and going up into your arm. So do these stretches for 5 seconds. Do them about 10 to 15 times in each sitting. You can alternate each stretch. You can do one lower, middle, and then go up, and then come back to the lower, middle, and upper. These are the 3 stretches which are for the front of your arm. Another stretch which is for the back of your muscles, towards the back of your shoulder, is that you're going to hold the edge of the door with your hand like that, and then you're going to pull your arm backwards. So you can, this way you're going to turn your chest towards the arm. In the other exercises, you were stretching it away. This time you're going to turn your chest towards the arm. As you do that, you will feel the stretch towards the back of your arm. So you do the same thing, you hold it for 5 seconds and then you let it go. These exercises, the reason I'm showing you these exercises and these some basic equipment and basic things, because this is available anywhere in your house. You don't have to go to a gym, you don't have to have certain bars or things to hang on to. You can do these stretches anywhere if you have a door in your house. When it comes to the recovery of the shoulder, either coming from the impingement or from the rotator cuff injury, once those injuries are healed and you are ready to exercise, you need to focus on two main components of your recovery. One is the stretching of those soft tissues and muscles, and the second is the strengthening of those muscles. So both of these components are very important and they are very integral part of each other. One thing you need to remember, the shoulder movements are not only coming from your shoulder joint. The shoulder joint is a joint between the small socket on the top and the big ball, which comes from this big bone in your arm. So the movement is not only coming from this joint, it also comes from your scapula. Scapula is your big bone which is behind your shoulder. So half of the movements comes from the shoulder joint itself, and the remaining movement comes as the scapula moves with the joint. So any exercise or any range of motion exercise, if it's only focusing on the shoulders and not on the scapular movement, it's not going to give you good results. So you need to make sure that your stretchings and your exercises include the shoulder exercises as well as scapular exercises. I'm going to teach you all those exercises which you need. Now I'm going to teach you 3 stretching exercises which are mainly for the muscles towards the back of your shoulder. Now these 3 stretches are in the sitting position. You can do them in standing also, but I'm going to show you in sitting, because when you do it in sitting, you can isolate these movements better than when you're doing in standing. So first exercise is that you stay focused on my shoulder here, this shoulder part. What I'm going to teach you, what we're going to do is that we're going to move these shoulders forward and backwards, okay? So I'll isolate these movements. What we are trying to do is that we're going to move the shoulder forward and back, and you will see my hand, it's moving forward and backward, but my chest will remain at the same level. So if you can see that, so we are not going forward and back like that. We are not going forward and back. So we are actually isolating the movement to the shoulder. So just like I'm moving my right shoulder, so see the difference between the two. This is going forward and back with the whole body. This is just the shoulder going forward and back. Shoulder forward and back. So we do it both at the same time. So both arms go forward and back. When you do that, you will feel the stretch towards the back of your soft tissues over there. This is one exercise which only focuses on the shoulder. The next stretch which I'm going to teach you is that it's not only going to stretch your shoulder muscles, it will stretch one of your big side muscles in the side of your chest wall. So for this exercise, you're going to lean a little bit forward like that, okay? You're going to stretch like that, and in this position, my hips are little behind my shoulder, so the hips are not right under the shoulder, so hips are a little behind. I'm kind of leaning forward, and in this position I'm going to just go forward, push my arms further forward, and then come back. I hope you can see that. Let me show you at a better angle here now. So what you see is that you put your arm here, make sure your body is straight up, your hips are a little behind your shoulder, and then you go forward and you go back. So you're not forward bending. You're not bending forward. You're not bending forward. You're straight, but you're focusing on your shoulders. So both shoulders go straight forward and then come back. You feel it right here. At the end of the video, I'll show you another way of doing the same exercise, but that literally can isolate between your body going bending forward and moving forward. But for that exercise, you actually have to sit on your kind of a on your knees, kneeling on your legs. So some people find it hard, but this is for those people who cannot kneel. The last exercise in this series, we call it, it's kind of a shoulder shrugging, but you need to focus more on the shoulder part, if you can see that. So you're moving your shoulders up and down, up and down. For people who can do it simple like that, this is one exercise which you do. So I'm going to show you that exercise which I showed you before. For that exercise, what you do is that you get into this kneeling position, okay, and then you put your arms like that, okay, and then you stretch your arms straight out. So when you stretch it straight out, your back is straight. So make sure you're not going like that. So you're keeping your back straight, your spine straight, and then you just stretch your arms straight. So as you do that, you're going to feel the stretch right over here. So this is stretching your shoulder muscles through your shoulder blade. All right. So do all these exercises 10 to 15 times, 5-second hold, and then in next video I'll show you how to do strengthening exercises for your shoulder.